Welcome to Lesson 6 in 213, Physical Disabilities and Personal Care. And in this section, we're going to talk about a birth defect called spina bifida. Now, spina bifida is a far more complex disorder than I'm going to get into here. And I don't expect you to get into understanding all the different kinds of spina bifida. But essentially what happens in spina bifida is that the baby is born with a spinal column that's not properly formed. And it turns out that process happens very early on in the development of the fetus, and that one of the reasons we're asking women to take folic acid these days is that vitamin B can actually be a preventive factor in people being born with this birth defect. So there are a variety of different kinds of spina bifida, including variations in which the person is born with parts of their brainstem or parts of their spine not properly covered by the bone and protective layers that are typically there. People with spina bifida, therefore, are commonly, again, comorbid with folks who have intellectual disability because, again, those same things can cause a person potentially to have neurological effects or cognitive effects. However, we should think of spina bifida itself as a physical disability. A really common thing you'll see with people is what's illustrated in this diagram. As they get older, they may have orthopedic issues or issues that have to do with the way their skeleton works. And it can affect their feet and their hips, and it can also cause a curved spine. This curved spine, you can see that the spine of a person, when we look at a person from the back to the front, the spine should look straight. And when we look at them from the side, it should essentially look like an S. If a person has scoliosis, you can see that the bend goes the opposite direction or also goes in this direction. So scoliosis is this sort of tilting to one side, and kyphosis is this person sort of hunched forward or shoulders forward. So these are examples of orthopedic issues that a person can have when they've been born with spina bifida. This can cause them to have weakness in their extremities or their legs or paralysis, and you may see that people are wheelchair bound or in a gurney again. They may also have problems because their digestive organs are not able to fully function because they are so compressed by the spina bifida, and that can cause them to have issues like incontinence. You'll remember again we talked about incontinence meaning a lack of bowel or bladder control or both, or constipation meaning that the person's motility doesn't work properly and food does not pass through. Normally constipation is when food blocks up or backs up in the digestive tract and the person can't go to the bathroom. They can't have a bowel movement. People can even have seizures as a result of spina bifida because, again, this can affect them neurologically. And this is the first time we've learned this term yet or so far in this module, but we'll talk about it again. A shunt may be inserted in the person's brain or along their spinal column. And the reason that is because a shunt is a drainage device. It's a tube that helps to drain the fluid that aligns your system. This is called the cerebral spinal fluid, and it's a clear fluid. And basically, if it builds up too much and pressure builds up, it can cause the person to have further brain damage. And so these tubes are inserted, and then they go back under the skin, and this liquid is back reabsorbed into the bloodstream where it is kept in balance. Now, when we're working with people who have shunts, we can't do a lot ourselves except make sure that we're inspecting the shunt and looking for it to be and taking good care of the person's hygiene, watching for signs of infection, and making sure that we follow the medical protocols associated with that. For example, having the person routinely visit their doctor and have the shunt inspected. Spina bifida, as we said, is caused at birth. It's likely something that is genetically predisposed. Some people are more likely to have it than others, and there may be environmental factors such as the nutrition of the mother. It tends to be more common in women who are older when they have their babies, and we talked already about the importance of a B vitamin called folic acid. You may have heard that women get something called amniocentesis done to test to see whether or not they have spina bifida, or a baby that will have spina bifida. Amniocentesis is becoming a less and less popular procedure for two reasons. So first of all, here's what it is. A needle is inserted through the abdomen of the pregnant woman into the sac of fluid that surrounds the baby, and a little bit of it is drawn out and it's tested. The two reasons why that is becoming somewhat less popular to do is that first, there's a risk involved in doing that procedure itself, and second, One of the reasons that people have done it traditionally is because they have sometimes made the choice of whether or not to maintain the pregnancy based on the results. And so as times change, people are having less and less thoughts about terminating a pregnancy because a child might be born with disability. So what do we do for people who have spina bifida? Well, surgery, and sometimes multiple surgeries, are done to help maintain the function as much as possible, particularly in the forms of spina bifida where the brain or the spinal column is exposed because the person is at very high risk. Physical care becomes important in the case of this person. So you may need to do some types of physical care for that person, as we've talked about, lifting and transferring, feeding, toileting, and so forth. Occupational therapists and physical therapists again may be involved here and may come up with specific routines and adapted equipment for that individual as part of their care plan. They may have specialized wheelchairs. Often people with spina bifida need particular pads, particular wheelchairs that allow them to sit as upright as possible. And I've often seen people with spina bifida have a very differing stature. They often look smaller or shorter, largely because of the compression of their spine. And so things may need to be sized for that person appropriately. Even something like clothing may have to have pads or different fasteners, like Velcro fasteners, attached so the person can be as independent as possible. Spina bifida, a very interesting disorder we've touched on just briefly here, but I would encourage you to look it up more, especially if you know you're going to be working with somebody who has a diagnosis of spina bifida.